Hello, good morning, everybody, and welcome to Preparing Students to Return to School Full-Time Following CDC Guidelines and a Daily Routine. This is just going to be a very brief overview. I'm Maria Huerta, Mental Health Liaison and Licensed Educational Psychologist from WACSEP.
Hi, I'm Artemisa Torres, Behavior Specialist with WACSEP.
And we both appreciate you taking the time to join us today. So, brief overview on who is WACSEP. We are your special education local planning agency who works in conjunction with your school district to provide a continuum of services and placement, staff and parent education, interagency collaboration, and administrative support that will ensure a high quality, individualized, free and appropriate public education for individuals with disabilities. And here is our URL address for the website if you're interested in getting more information. And just a brief disclaimer that the information that we are sharing today includes a brief introduction addressing the importance of daily routines, as well as a reference to the back to school planning checklists to guide parents, guardians, and caregivers, which may be accessed through the CDC website. And here is the address if you choose to use that. So the Child Mind Institute suggests that families start making the necessary readjustments to school life before the first day of school. I recognize that we are just going into summer, but this is something you can come back to and really help your student prepare as we move closer to August. So let's not wait till the end. The sooner we prepare them before the first day, the better. And I'm going to be reviewing very briefly the back to school planning checklist to guide parents, guardians, and caregivers through CDC. And the checklists are intended to help parents, caregivers, and guardians prepare for the upcoming school year. So I'm just going to go into the checklist. Okay, and this is exactly what it is. It is a checklist that's going to help you prepare. So I'm going to zoom in just a smidge. And the way that you use it is you're basically going to write notes for yourself. I'm not going to go over everything in depth because it is an overview, and it's better if you have an opportunity to review it at your own leisure so that you see what might be more beneficial for you. But it's really reviewing logistics that you want to take into consideration upon the return to your child going back to school full time. So, checking in, here's something if you want to see signs of illness. When you go to the website, you can actually hit that. It'll show you, what to do if you're sick based on the CDC guidelines. Oh, excuse me, going back to that. Oh, my heavens. I'm so sorry. Here we go. Okay, so as you can see, there are different highlighted and underlined portals that you can go to if you want additional information on that. So you want to see if your child is sick, make sure your child does not have a sore throat or other signs. If your child has a close contact to a COVID member, you want to have some notes here. It is important that you identify from your school district who's the person that you would be reaching out to. You can have their name and their contact information. You want to be familiar with any testing sites. We want to keep in mind that because everything with going back to school after the pandemic is fluid, this checklist may look a little bit different as we get closer to August, and they might have different avenues, but you have the website URL address, and that will help you get there so that you're up to date. If you have your child vaccinated, it goes through all these different dynamics. So you do want to make sure that you talk to your child about precautions to take at school. We would refer to this as priming, where you are preparing them what to expect. So when we know what to expect, it decreases our stress and it gives us an idea once we see it like, okay, my mom or my dad spoke to me about that. So I did expect that this was going to look the way that it is. So talk to them about what is their classroom going to look like? What should they expect? And the way that you find that information out is go to your district's website, because it could look different depending on the district. Develop a plan as a family to protect your household members who are at increased risk for severe illness. This will help reduce any stress that your children might have. For example, if you have a parent or somebody that is more susceptible to getting sick, we don't want the kids to worry about bringing something home and, maybe they don't have COVID, but they might have a sneeze or a cough, and it might create some stress. So we just want to make sure that we're taking plans. When you get home, let's wash our hands first, maybe change your clothes, whatever your family is comfortable doing and what your family decides to do. But this again is a checklist of giving you ideas of what you can do to help prepare yourself, your family, and your child to returning back to school. Being familiar with your school's plan, making sure that your information is current at school, especially your phone number in case of an emergency. We wouldn't want our kids to be waiting because we don't have the current information. And sometimes we change our phone numbers and we just forget to let the schools know. So let's just make sure that we have all of the updated information and that the school knows who to contact and at what numbers in case of an emergency, or if they need to reach out to us for questions on anything specific. Again, because it's fluid, we want to make sure that we're talking about possible school closures or periods of quarantine. We don't know that that's going to happen, but we can definitely discuss the possibility of, if it does, what will that do? What will that look like? And you can have some notes here. Planning for transportation. So it's a list of things that you definitely want to look at. If they pertain to you, like if your child has an IEP or a 504 plan, you want to ask the school, how are these services going to be provided for them? If there's like a cohort model, which means that in some instances they might have a cluster of kids that they want to be together, consider limiting your child's in-person out of school interactions. Again, something that you're comfortable with, your discretion, but go down the list. Talk to your school administrators about their plans for physical education and physical activity. How do they plan to ensure that students are following practices to reduce COVID? Here's a section on masks. We don't know if masks will or will not be required. That's going to be district specific, and it's going to be based on what the CDC is providing for guidance. So again, that can change as we get closer to August, September. But it is important that you have a plan. So let's not wait until August, September. Let's talk about it with our family. Let's look at this checklist. Here are some great ideas. Have more than one mask. If you have a washable one, then let's have a clean one, and maybe one that needs to be washed so that they're not worried about not having a clean mask. Make sure that it's fitting appropriately. Label it. We want to talk about, let's not switch masks with our peers. Sometimes the little ones might like the mask that somebody else is wearing and not recognizing that it's not good to trade. They might want to trade. So you want to have those discussions. Praising them for wearing their masks, if that is something that is going to be expected, going down the checklist. And then mental health and social emotional well-being, there's a section on that as well. So I do want to preface in saying that there is going to be some type of nervousness that is anticipated for everybody. Everybody's going back after a long period of time of being out of school. So reacclimating is going to be expected for all the students. They're going to have to get used to being in school all day, in person, the expectations and demands of sitting and doing work, of not necessarily having those breaks of getting up when they need to when they were on distance learning. So talk to them about what that's going to look like. Ask your school district, what will the classroom look like physically? Are there going to be fewer desks as opposed to what they're used to, so that they know what to expect? And this is really important just overall, but especially for students that might be transitioning to a brand new middle school or a brand new high school or a brand new school altogether, it will be a good prepping and priming opportunity to have those discussions. Talk to them about how school is going, about their interactions with their classmates and their teachers once they're there. Anticipate that there's going to be an adjustment period. So there is going to be some changes, especially for the younger ones. You know, it might be like the first day of school all over again because they might be a little bit angst. So it's also important that we remember that they're going to look to us as to how to behave and how to handle the situation. Our modeling behavior is going to be their guide in terms of how comfortable they should be feeling about their return. But we do, again, want to expect that there's going to be a reacclimating period for all students. Try to get and be abreast of as much information as possible. If you can attend school activities and meetings, read the literature that they might send you, know who you might want to contact if you have questions. Maybe you want to put your school district's website here so that it's quickly at the forefront of your mind and written down, and you know where you can email or who you can call for questions, or just jump onto the website and they'll have information. So you want to ask your school about any plans. And we're not going into any specific plans because as a SALPA, we do support 7 different school districts, and each district is going to have their own protocol and their own format, of course, under the guides of the CDC and the Department of Health. You want to check and see if your school has any systems in place to provide mental health support for students. Check if your school has a plan to help students adjust to being back in school. I know in speaking with all of the districts, are all working together and collaboratively with their mental health support, with the school psychologists, with the school counselors, with the school social workers, with the teachers, so that they're working as a cohesive team to be as supportive as possible for all the students that are coming back. Reach out to them and see what that program is going to look like, if they're going to have any social emotional learning curriculum that you want to be aware of and that maybe you can also supplement at home. Check if your school will provide training for students in mindfulness, which also incorporates social emotional learning in the classroom. And again, going back to, they're going to be looking at us to how we are feeling and how we are reacting to their return to school. So it is important for us to self-reflect, but also important for us to practice self-care. So we want to practice taking deep breaths, taking breaks, getting plenty of rest, exercise, eating well, staying connected. And if you're interested in some PowerPoints that address that, you can go to the WOCSEP website. So that basically concludes the overview of how you can use the checklist. And now we're going to transition to evidence-based practices, developing and maintaining daily routines.
Thank you, Maria. As Maria was mentioning, we are going to be experiencing some changes, and post-pandemic, we are going to return back to more regularly daily schedules. And this is a big change for our children, which may cause some anxiety. And one way to combat that is to develop and maintain daily routines, which is what we're going to review right now. And a quote from Rachel Goldman, PhD: when people don't have a routine or structure to their day, it can cause increased stress and anxiety, as well as overwhelming feelings, lack of concentration and focus. And again, we really want to concentrate on building some daily routines to try and help our children combat some of those feelings and anxiety as well. So, why are routines important? So, familiar activities and routines can create comfort during challenging and uncertain times. Predictable routines can help a child feel confident and secure when their routines are familiar. And schedules and routines help children feel confident in their environment, or I'm sorry, feel in control of their environment, um, feel safe, secure, and comfortable, as well as it lets them know what is happening and what to expect next. Develop a schedule with your child. You do want to develop a schedule with your child, and many of our children learn best if they can see the information. So, creating a schedule adds structure and predictability into your child's day. You want to take a moment to think about how much you rely on your to-do list. So, take a moment to think about that. How much do you rely on your to-do list, or even just writing in your daily planner? It keeps you organized and you feel accomplished when you have completed your to do list. Our children feel the same way. So, when we develop a schedule with our children, you want to get them involved. Get them involved in creating and organizing their schedule for their day by giving them structured choices, such as when you get home, do you want to have time to yourself first, or do you want to start your homework right away? So, that's what's known as a structured choice. You're controlling that choice, but you're giving them two options. And giving them those choices allows them to have a sense of shared control with you instead of feeling like they are simply being told what to do. And schedules come in many different formats, such as pictures or written schedules. When you create the schedule, take into consideration other members of the family and how their schedules may impact each other as well. And also make sure you intermix preferred and non-preferred activities. We want to make sure the schedule includes their daily routines, school time, movement breaks, outside time, creative outlets, and time to disconnect from the computer and relax their mind. Some important routines to include on your schedule would be your sleep and wake routines, such as bedtimes and wake times. Daily living skills such as getting dressed, eating breakfast, taking a shower, or even when they arrive from school, as Maria was mentioning, maybe to protect some other members in the household who may be more susceptible to COVID-19 or getting another illness. Maybe having them wash their hand and change clothing when they get home. So some of those daily living skills to include in your daily routine. And then household chores as well, making the bed, taking out the trash. So again, just making sure that you include some of those routines that you want your child to complete on a daily basis. So you can create some visuals which will help your child be able to follow the routine. If you think about it, you yourself probably have some kind of schedule. I know I particularly have everything on my iCalendar, right, on my iPhone, so that I know exactly what's going on. So schedules and routines should be presented in a visual format that the child can reference. And again, the visuals can include something like a schedule with a picture, maybe even just a checklist, or calendar events. Again, calendar events is something like that would be on maybe a digital format, or it can even be on a calendar that they, a visual calendar that they can write on. So here is an example of you're thinking to yourself, well, what does a visual schedule with pictures look like? This is an example of what it could look like. Obviously, this looks like for a kiddo who is younger, but you could still take this into consideration for your older kiddos. Just considering, what kind of pictures they would need and able to, in order to reference what they need to do. So again, these picture formats are really good, especially for some of our kiddos who maybe don't have language. So visual schedules with pictures is a great way for some of our kiddos without language to reference their daily routine. And then some children prefer to have their schedules in a daily planner or on a calendar on their phone. So one of the great things about having a calendar on a phone is if you connect that to your home assistant, such as Alexa or Google. I know that I've had a number of students who have been able to input their events into their digital calendar, and then Alexa reminds them of their schedule and the routine, reminds them of what's coming up next, how much time they have before the next activity. So it really is a really great tool to have your schedule on a digital calendar. And then again, if you can connect that to some type of digital assistant, such as Alexa or Google, it's another great format for our children to have access to their daily schedules and routines. One thing you want to take into consideration, and Maria mentioned this as well earlier, so I think you're going to hear this a number of times during this presentation, and we don't mean to beat you over the head with the same message, but it really is important to start the routine before the first day of school. Our children will be better prepared if they start their new school routine a few days before school starts. You want to think about getting your child into the routine of normal school hours. You want to think about getting bedtime to start occurring at the same time it would a regular school night, as well as wake up times and morning routines, which should reflect the routine that they will follow when they are back in school. I think we all know that summer is such a special time for our children and us adults alike. It gives us a break from the normal hectic schedules we typically carry during the regular school year. Although some of us may loathe the idea of getting back into a regular routine, or maybe some of us hate the idea of taking away the last few days of freedom from our children, keep in mind that preparing our children for returning to school will only help them get off to a better start. And so just some summary and takeaways. So I'm sure that you were listening to us during the entire presentation, but if there were some summary and takeaways that we could just review with you and think, what are some of the important things that you can take from this presentation would be: one, keeping the CDC checklist handy. It can be helpful for your overall planning. Two, implementing a structure to your day can give you a sense of control. It can also improve your focus, organization, and productivity. Three, schedules and routines can create comfort during challenging and uncertain times, which will really help, I think, not only our children, but ourselves as well get back into our regular routines post-pandemic. And four, prepare your child for the routine before starting school to allow your child to adjust to the new routine. Allowing them to adjust to the new routine will really just help them overall be successful when they start the new school year.
Thank you, Artie. And here are the resources in which we utilize to put our PowerPoint together. We want to thank you again for joining us and going over very briefly the overview is the importance of routine, using the CDC checklist, but also making sure that you are reaching out to your district to see what are the protocols and what are the planning that your specific district has, which you can then use in conjunction with the CDC checklist and helping to prepare and prime yourself and your child to returning back to school full time. Have a good rest of the day, and we hope that this was helpful information.